Well, the world has still gone nutty, buddy, even downright cruddy, buddy. Wish I missed the past, buddy, but there's still Buddycast. No, don't be naughty, go meet everybody here on Buddycast.
Ladies and gentlemen, please welcome the founder and host of Buddycast, Nick Sorensen.
Welcome to another episode of everybody's favorite show, Buddycast. I'm your host, Nick Sorensen. Joining me today is a new buddy who might be very beneficial to all you pet owners out there, my buddy, Patty. How you doing today, Patty?
I'm doing great. How are you guys? How are you doing?
I'm doing fantastic. Thanks for joining us on an episode. I'm interested to learn about your career.
Okay, yeah, I'm willing to tell you about it because it's been extravagant and wonderful.
So you're a vet tech. What inspired you to seek a career as a vet tech?
Well, I can tell you, going back about 40 some years. I know I wanted to be a nurse because I remember in kindergarten we had to make something what you wanted to be, and I drew a little nurse and had a little nurse hat. But then as I got older, I was like, I really like cats and dogs, and maybe I should be a veterinarian. I originally wanted to be a veterinarian, I think, but it ended up, I wanted to start out slow to get there because I wanted to get my feet in the field. And I tell you what, it's like those two things came together, like from when I was in kindergarten to when I was a teenager. And I wanted to I'll start out as a veterinary nurse. And I tell you what, best thing I ever did, because we make such an impact. We're all there for one reason. So we all work as a team, and it's the best thing I ever did.
Absolutely. And when did that inspire you to start your own business?
Over the years in the field, I've been in clinical practice for over 30 years as a vet tech. And what inspired me to start my own home business mainly is, emotional ties with the pet is a big thing. And when an owner's pet is diagnosed with a new illness or injury, they have to do a lot of this stuff at home after the animal's discharged. And, they need a lot of support, and they call in and things like that. But sometimes, it's been nice to be able to take the nursing skills from practice to the pet at home. Okay, when I can. So I guess over the years being in practice, I kept seeing that as a thing like, well, how can I help them more at home? And plus, the career in general is very physical, very mentally taxing. It can be. But, it was time for me to kind of step back from a lot of that physical work because I didn't want to retire and be all, beat up. But it's just a very physical job. And I saw the need for it. And I tell you what, the responses have been wonderful. I love private practice. I miss a lot of what I used to do. But seeing this turn into a new avenue of pet care, it makes it worthwhile, especially when I've got a sick pet. Real quick, like it had diagnosed with diabetes. Owners are sent home with a variety of instructions, a new illness, a dog that's not feeling that great, or cat, and it's overwhelming to them. And being able to bring that support to them at home is priceless, I think. And a lot of people have been responding real good to it.
Nice. How many clients do you think you are currently up to right now? Like how many clients do you think?
Routinely, probably, and it doesn't seem like a lot. Routinely, it's like probably 20. But then, as time goes on, I get lots of different cases that need help, and they, like say subQ fluid therapy, a bandage change, drop-in visits, like routine wellness ones. It's not a high number, but it's growing. So, I guess over the past almost 3 years, because I started right before COVID, my list has doubled and actually tripled. So I would probably say, I'm taking a wild guess of like 150 people. I've helped or made a difference,
Nice.
So it's growing. It's taking its time.
Hey, everything that comes to perfection always had to start somewhere, Yeah,
I look at that now, and it's grown, and people really, really responding to it. And I can give you a case example real briefly.
Go ahead.
Hey, I had a dog in my neighborhood. Okay, and I went to a hospital across town. And this was like probably a year and a half into COVID, so masking and all that. The dogs, you had to wait outside, can't go in the hospital and all that. I had been in surgery, anesthesia, and recovery, and floor nurse for a long time. And like I said, decided to start a business. And I talked to her and I said, okay, well, the dog had to get a mask taken off its foot where it was not going to heal they couldn't suture it, basically, just not enough tissue. So I went to its house every day for 5 weeks. And this dog is an older dog. He didn't have to go sit in the parking lot. I mean, a nurse assessed it every day, stayed in touch with the clinic, gave the nurse reports, everything from post-surgical recovery for that 5-week period. That dog didn't have to extend itself and spend 2.5 hours a day going to the pet vet. I mean, and I'm there to work in conjunction with the veterinarian. Okay. Mm-hmm. I'm going to follow their orders. Obviously, I can't make those orders as a nurse. But I'm going to tell you, if I see something, I'm going to say something to the vet, like, okay, I think he's painful, and give him an email and say, this is what I'm seeing. And sometimes pets, the owners don't really know, unless they're blatantly painful, whining and crying. There's a lot of other physiological parameters I can check while I'm there and say, okay, this is what I'm seeing. He may need more of this, but I need to talk to the vet first. So that was the rewarding one. That was right when I first started. So, yeah, it's been nice,
Wonderful. And it is nice because there are some dogs that, you take to the vet just for a routine checkup, and mm-hmm. the minute they're in the car ride, they're this happy, joyous, go lucky, we're going for a car ride. The minute you pull into the parking lot and open the door, it's like a light switch. Like it's just one of those moments where they go from happy, joy, lucky to they will sit on the ground and make you drag them in if they have to.
There's a lot of pets that pardon me, that are, I like that. And being able to bring some of the routine wellness care to the home has helped mm-hmm. immensely. And some dogs have a combination of medications that work, but they work with, sometimes they need meds, or they do fine with distraction. But taking that element out of there can make a difference. And chronic stress, as we know, is not great for us. Mm-hmm. But once again, I work with the veterinarians, that's it. We're a team thing. And I don't work for one specific veterinarian. I mean, but because I'm my own entity, but it's been nice to have response. And actually the veterinarians in town have been referring me out. I've had a couple of clinics refer me out for esophagostomy, tube feeding, and subcu fluids of a cat that was really sick there last year. So it's nice to really bring the routine wellness or medical needs when possible. Now, a lot of people ask me, and I can tell you what I can and can't do. A lot of people ask me, do I do the vaccines? Well, I'm like, no, that has to be deemed healthy by the veterinarian. Euthanasia, mm-hmm. I do not do that. They've got to have the drugs for that. I don't do those types of things. I don't groom. I'm not a groomer. I'm a veterinary nurse through and through. If it's a grooming, I'll find you someone, because I got lots of, referrals, people to set up with. So, but it's been good.
Mm-hmm. So a quick follow-up question. Have there ever been animals that kind of are territorial, like you're coming into their house?
Yeah.
This is my area. This is my domain.
Yeah. And this is the big thing. I got to talk to you first before we make an appointment. Mm-hmm. I need to have all this addressed before. I mean, I go through everything. I need to know if there's any aggression history, bite history. I mean, I need to be cautious. I'm a one-woman show, and safety is the utmost concern. We have to have boundaries on that. We have to kind of know. There are some dogs and cats, some dogs that it doesn't work out with, hey, I cannot safely do this. Unfortunately, so-and-so is going to need to go there to have this done, and gone are the days, we try not, we look at I came from a section, and I make it sound like I'm old now, but, I was in tech school in the late 80s, early 90s. And back in the day, I'll tell you what, let's hold it down. Let's get his nails done. But now it's evolved to this whole emotional thing. And I've seen the changes in veterinary medicine, from drugs, changes, pain control, the way we handle them, the way we draw blood. Some of our techniques have really changed. And I can tell you that, and that's for the better. We read these animals. We try to watch them, based on the anxiety or fear they're having. So it's nice to be able to have options to help them. Mm-hmm. But it's been nice to see the changes in vet med over 30 years too. So
yeah. So what do you do if you do have a territorial dog? If you do have, or some pet that really
Well, if it's really, we're having aggression issues and things like that, and it's not safe for me, it will need to go to the vet clinic, and they'll have to do the appropriate things. I have to assess each situation. You know what I mean? If it's going to be a safety thing for me, I can't put myself in danger, and that's not good for them either. So we just got to be on the same page with that.
Yeah.
Now I've seen animals. I've tried to and work with some animals, and like I said, one or two that didn't work out, and it's the way it is. I do all the best I can with what I got, and I'll give you every single thing I can think of before it comes to that point.
Yeah,
You know what I mean?
and that's what I was about to ask. Like, have there been animals that have started out like protective, but then realized, okay, she's here to help. She's here to.
Yeah, I mean, you have to read them. Yeah, like I said, look at their cues that they're giving me. They talk to us by body language. I look at everything from ears, eyes, feet, motion, stance, everything. Yeah, but people, they need to be honest about a dog. If it's not, you can't sugarcoat it with me or any. They shouldn't.
Oh, he's a sweetheart. You won't mind him at all.
Yeah. Well, you got to watch. He won't bite. But you know what? We are trained as technicians to look for keys of anxiety or being scared or fearful. I mean, we have to be careful.
He's just fine. He's not doing. He won't bite you. Meanwhile, the dog's shaking like a massage chair.
Yeah, they're also different. I mean, I've had a lot of super anxious dogs, and I tell you what. It's like 3 or 4 of them I've worked with them for a year and a half now, along with meds, and they've been great dogs to begin with, but they have come a long way with exposure work and meds, a long way. It's like these dogs are happy to see me. Now, I'm not the miracle worker. I can't say I'm a miracle worker for everything. So, but the routine wellness, I do have a couple of dogs I see routinely, like for ear cleanings, and he's been a great dog. So, and I still do it every week for him,
Nice. So what type of services could you offer? I know we have a lot of buddies that aren't from our area. We have buddies from all over. So what services could you offer our buddies?
And I'm going to tell you where I travel too. I can tie that into that. I know that's part of the question, right? I think
that was my next question.
Okay, yeah. So I figured I'd tie right in there. Yeah, I knew it was coming. I was like, I know who's going to ask me. Because I know you say about the viewers from different areas. I travel, about. Well, I'm in Erie, so I can go as far as Lake City and as far as, I just went like Ripley. I don't know what's that. I just went blank what that other place was. I just went like not Ripley, Findlay Lake. Sorry, Findlay Lake, not Ripley. I think that's in the same area. But anyway, and I go as far as Edinburgh, but I don't go further than that because that's out of my time. That's out of my time zone, or not time zone, but just by distance.
What about like Western New York, Eastern Ohio?
Yeah. I don't go really to Ohio. No, I don't go to Ohio. Yeah, Lake City's as far as that way I go, into Edinburgh, into Findlay Lake. Yeah, all sorts of in between stuff. What can I help people with? Okay, I can help people with quite a bit of things. Your routine wellness procedures. A lot of vets have gotten backed up because of COVID and lack of staffing. So there are some things I can aid with. Like your ear cleaning, your gland expression, just minor mat removal, nail trims. Those are some basic things, like basic care items. But then I can get into the medical cases where you could have wound care, nursing post-op assessments, bandage changes, fluid therapy, not intravenous fluid therapies under the skin. Anything medically related that an owner sent home with, medicating cats. I also do some consults too on a lot of veterinary topics that, like by Zoom or something, or talking to the owner about lots of things from feline urinary tract health, behavior, weight management, dental disease. There's a whole list of things veterinary technicians, because we're like big client communicators. We're that next step person to the vet. There's so many things we're trained in and we have experience with. So those are just some of the consults that I can aid with. New kitten, new puppy things. Getting animals used to veterinary related procedures is something I'm going to add in the future. Because these are some of the things you take a dog and he only gets manipulated once a year and the dog doesn't know what's going on, but you can actually train them. I'm actually training my cat to get in the cat carrier. He's doing it too. A cat getting into the carrier. That's why 80% of our cats don't get to the vet, because I tell you what, the number one thing, that cat sees the carrier. Where's it? Where's the cat? He's gone. Cat is gone. right? Just like the dog gets in the car, cat's gone. So you want to make that a good place. So I do some training things with that too. So,
Yeah.
So I have a lot of experience in emergency care and nursing care in general. That stuff ties in and can slide right into taking care of pets.
Mm-hmm. And you do make a great point, like we were talking about earlier, or like you just mentioned, cat sees the carrier gone because it knows where it's going. Or we were talking earlier, like the dog gets skittish the minute they hit the vet. They they were just excited to go in we're going for a car ride, we're all this. The minute they see the vet, oh heck no.
Yeah. Yeah, and that's the thing. I mean, a lot of people got dogs during the pandemic, so they didn't get that chance to take that dog in for what's called a happy visit, so the dog can go in and get treats and positive reinforcement. We lost that, and it's like you're almost rebuilding your steps now because you got a lot of pandemic puppies. So, but you got to work with them, and that's the biggest thing. The work's got to be put in to get to that point because. Depending on the dog, it can be done, but it all depends on the dog and how much the owner is getting involved. And time is a big factor too, with these things. With my cat, I have to train him. I have to do it, small time with the cat, like 3 minutes here and there, because cats' attention span, they're like, I'm out. Dogs you can get a little more with sometimes, but cats are like, yeah, I'm done.
Yep.
So
let me get my next question. I know we talked about it a little bit earlier, but like you really have that skittish pet, but for a fact you can work with this. Like it's not so severe that like they're gonna like you just have to throw your hands up and say, hey, you have to take them to a vet, give them medication. How do you get to that point? Like you're workable with them. Like how do you get to
I think I gauge it a lot, once again, I'm thinking of the dogs I've had to work with from the beginning. I have to read their body language each time. And sometimes you're doing good with a pet at first, like it's a young pet. Okay. Say we worked with them at 12 weeks old. Now the dog is 5 months and now it's they go through a second fear period. They have a fear period when they're real young. That's why they need to socialize, but they get up into another one and they're totally not the dog I remember it being, and it's a lot. Things change. They like to figure out what they don't and like, and they do like. When do I notice if it's not working? When I've exhausted all options working with the pet, I'm here not to stress that pet out. I'm not going to stress them out where it's horrible and the dog's hiding under the chair. I have to work with them each time and assess them each time. And if it's getting worse and we've tried trials of different things, it may not work, But I know it sounds like I'm repeating it. So it's assessment is key. Yeah, assessment's key. Yeah. That's how we see progress. We have to assess and progress. Are we progressing? Do we have to take a couple steps back in a training plan to get them used to it? Yeah, but I tell you what, routine has to help with a lot of these dogs too. You got to have it done every so often, not every 7 months to get their nails done. You got to do it more often. Yeah. Small bits. And I'm not go ahead.
It's all about like small bits to getting them where like that's eventually going to gain their trust. That's eventually going to gain them to when you come over, it's not going to be, she's here, I'm out of here. It's more going to be like, hey, she's here. I'm getting a spa day.
And that's what's happened with some. And there are some that it didn't,
Yeah.
You win some, you lose some, you do the best you can. But I tell you what, there's like 4 now, and it's taken a long time. And sometimes people end up finding a way to do it themselves, and I give them some of the tools at least, and then they've worked it out themselves. And if anything, if I don't keep them as a client, I've given them the tools they need to have the success. I'm not in about, they're not doing it anymore or they don't want me. I can't look at it that way. We made an impact somewhere, and that's what veterinary technicians do. We make impact every way, every day. I could say that to the cows come, and we're never just veterinary technicians. The things I have seen and done in practice are just things I remember reading about. I'm like, oh my gosh, I can't believe I just did that, or I did that and it helped the dog. But every day I'd have like a bunch of cases on the board, and you have to streamline. You're working with your team. It's a great feeling to see these dogs and cats in a different way now to be able to help them.
Absolutely. Do you have like a story, like an impact story of a time that your service really made a difference?
Oh, the dog with the foot. That one I told about earlier with the little surgery. Some kitties with when they were kidney failure cats, but unfortunately they only survived for a amount of time. But I tell you what, when they didn't have to bring the kitty in for the last, say, 4 months of its life to have fluids done at home, they didn't have to travel to the vet every other day. That's what I saw in the 90s. And I remember, I'll never forget this lady, I can't remember the cat's name, not late mid 90s. She would bring the cat in and go, oh, here's Emma. And Emma, she was like, nah, I'm not having it, but I just did the fluids. But see, she had to bring that cat there every other day. So it's those little things, you know what I mean? Such as that saves these animals time, saves the stress. If your cat or dog's already in a medical condition that's, causing stress and taxing on the body, let's try to make it better when you can. So those are two stories, I guess you could say.
Mm-hmm. Hey, speaking of clients, I got to ask about someone. You have a notable client here that everyone has seen and loved, our buddy Chloe.
Oh, yes. She's good. She's good. And this is the thing. Every dog is unique.
Mm-hmm.
And she's every time she's going to get a little bit better. And do we have to tweak her medications? And if she's on meds, so we might use just a couple things. And I want to give all her history away, but that's the thing. We have to work with that dog. And I tell you what, working with every dog, and this saves the dog from experiencing all anxiety, especially got arthritis and things like that. On top of it, every session is different. Every session is not perfect, but I'm hoping she's going to be one of those that keeps progressing. And she doesn't, like I said, she's still hanging out with me in the living room, so that's good. So she's not hiding underneath something. Mm-hmm. So she's still happy to see me. But yes, she's a good girl. So
yes,
I'm happy to have her.
Yeah. So I'm really loving what I'm hearing, just especially the stories of like the dogs who have gone from like scared to death, oh no, she's here, to hey, Spot, hey,
Yeah. I like seeing them too. It makes me happy. And it really helps when owners too also have put some work in, with a lot of them, and they're all different. And some aren't just have it wired in their head that this is a fearful thing. And they're always going to have that. Some of them.
Mm-hmm. So that was my follow-up question. I apologize. It slipped my mind earlier.
Oh, it's all right.
What are some tools that you could offer, like to some, to people doing it on their own, like when you're not there? Like what's some homework you can give them?
Well, some homework is the biggest thing, with you have a dog, or a cat, is having them to get a station where they work at. Like you can get a dog to get used to going to a mat, like a yoga mat. Okay, this is time for the training. It starts there. I've done this with my cat so far. I've got him used to, with some training, some basic stuff to get him to a mat. So he knows that station, it's time for a treatment or something. And I'm practicing I'll just give you an example with my cat. I haven't got to the syringe part to show him the syringe because I want to get him used to getting meds. Not that he needed meds, but these are some of the routine procedures animals might need down the road. But I was doing the physical exam stuff on him because he's kind of one of these grumbly cats that's like, So doing some of that base work at home may help, getting them to a mat station. As for nails and things like that, I'm not going to talk about the cat because he's feisty to begin with, so we haven't even got to him yet. But if you have a dog, it's one of those things where you have to almost go down a ladder of their exposure work and read them. And I think with dogs, I think it does help if you have some basic commands down with them, because that really can get them focused. And if they're food motivated, things like that, then you can work down and watch them for their response. Okay, there's a multitude of ways to go about doing that, but those are starting points, I think, is a big thing with dogs, because they're just all over the place, and they don't. Some of them don't know that stuff, and like I said, I met a lot of pandemic puppies that I've worked with, and it's taken some time, but now they accept me, because I've had to work with them and and do some of the reinforcement with them. The other one I think I'm working with is a little bit scared still, but we're working with her, or him. But I guess I get some basic stuff, I guess.
Yeah. So give me some homework. I gave you, my situation about my dog earlier, who, is very skittish when it comes to the paws from past experiences, maybe.
Yeah.
There's some things I can do so the next time I take him to the vet, they don't have to like muzzle him just to get a nail clipping.
Well, once again, they have to be safety because we're reading the dog there. We can't
Yeah.
have that go on. But to get her, is it a girl?
It's a
dog?
boy.
Boy. Oh, sorry about that.
No, they good.
If you have your significant other, maybe hold on in a gentle way. And you could start with some. Did they ever try distraction at the hospital with anything? He doesn't like it too much. Like distraction with peanut butter, cream cheese. Did they do anything that?
Good or not?
Well, that's a starting point, but you always have to watch for those warning signals. And you know your dog the best personally.
Mm-hmm.
But if she's holding on to them, you can distract with cream cheese and slowly just go down the back end. Dogs and cats are different sensitive spots, we never really want, and back in the day, it's like just get a foot and get the nail clip, right? But I would start with, getting on their back if the dog will let you, and sliding down and gliding and watching that response and maybe touching a toe. Do you know what I mean? If she's holding them and you can just slide down like the dog's here, and just hold a toe for a minute. And if the dog lets you, and usually when I tell them to do that, this is not technique for everybody, but you could start with that and then reward right away. That might help to start.
So guide it down, like guide.
Yeah, you could see and there's different protocols and different steps to do it, but that's one of the beginning points is try to distract and watch her signals. You can even, if he, you're holding on and you touch it aside and he's like looking at you, I wouldn't even start to slide down yet because he's already showing he's a little bit fearful. So you have to watch for some signals.
Okay, so watch the facial expressions, watch
ears. Yeah. Ears flattened back. Why? Yeah, they call it whale eye. Like they look like this. Panting, or they do a lot of lip licking or yawning. Yawning is a displacement behavior for a dog. Mm-hmm. So that means they're anxious. So, but also if you guys feel you need to do with a muzzle, if you're trying, with an exposure where I would say they have that, but you have to read the dog and be safe.
Yeah. Better safe than sorry, basically.
Yeah, they're all different. Mm-hmm. That's the basic stuff. Mm-hmm. That's not like detailed pinpoint to his specific situation,
Mm-hmm. Well, that was a good tip. That was an excellent tip. I think we're gonna give that a shot just to see,
Yeah, we'll have to talk about some more.
Yeah,
that's the end all be all, everybody. So every situation's different.
Exactly.
Call me if you need help.
Yeah. Brings up my next question. Mm-hmm. For our buddies out there watching, where can they find you? If they're watching this episode, hey, I like what I'm hearing, could really use some help with this. How can they contact you?
They can contact me at the name is Professional Veterinary Technician Services of Northwest PA. I know it's kind of long. They can also contact me via email, Patty Cioccio. pattycioccio.cvt@gmail.com or 814-480-0702. That's my phone number. You can Facebook me, but I'm going to need to talk to you first. I don't do appointments through Facebook. I need to talk to you on the phone. Before making any appointment, I need to get history. I need to know what's going on so we can make an appropriate plan for whatever you need. Whatever I can help you with anyway.
Awesome. Mm-hmm. Mm-hmm. And I agree with that because, one thing online sounds different than on the phone,
Yeah. Oh yeah. You have to get the information you need. And I send out, like, we want to set something up, I do a meet and greet with you. And then, prior to that, I'll send you some paperwork and information about my business because business policies and all that good stuff. So it's like, I'm not the vet, but it's a business and I'm learning a lot because I come from putting IVs in and, and being in major surgeries for 3 hours, and recovering patients and nursing sick patients back. And I missed a lot of that, but it's been neat to bring the medical cases. When someone gives me a medical case, I'm happy because I'm like, I get to write my nursing notes.
Nice.
And you get a report too, because I like to send reports to you. So every detail is important.
Exactly.
There is no detail that's not important.
Mm-hmm. So, buddy, I got 2 more questions for you. First off, please know you're a buddy, not a guest on the show.
Oh, I like that. Mm-hmm. Yeah.
So my buddy Jonas Kane at #Positivity, he wants to know, in your own words, what does it mean to be someone's buddy?
Oh, I've had a lot of buddies, and I have some real good ones. What does it mean to be a buddy? Well, I tell you what, someone that's supportive of your goals. I think that's a big one, especially in vet med, because I can tell you there's a lot of tough stuff in vet med we have to deal with, but having the support, someone that listens, those are the biggest things, camaraderie, especially in vet med and in the medicine field. We're all there for one thing, regardless of how much training you've had, regardless if you got a degree. Veterinary technicians, there's licensed and non-licensed one, and sometimes and I've been in the field long enough and I've seen the drama that can happen between licensed and non-licensed. You know what? You're all here for one reason. Mm-hmm. You're there for that pet. Your focus is on that pet. So that's what. But anyway, that kind of went off track there. But anyway, that's a buddy, supportive, and I had a lot of good ones at Erie Animal Hospital. So
nice.
I miss them all, but they get to see me when I show up, and they're like, "Oh, it feels like my home." 25 years of my life was there.
Brilliant. You're right. There's some buddies at work that never leave you.
I walk in there, and I used to live behind the hospital from 95 to 98 before the PEC was around, and I took in emergencies all night, and then I worked the next day. So don't ask me how I did it. I was 21. Wait, 23 to 28. No, 25 to 28.
Mm-hmm. Wonderful. The final question I have for you is what we call the ultimate Buddycast buddy question. You ready for this one?
Yeah.
What is your advice to anyone out there watching who wants to be a vet tech one day?
Well, as we know, this field is very emotional, very physical. And take care of your body. Mm-hmm. It's necessary. We can run into some injuries if we're not physically fit. And I found that out as time went on in my 30s, things change, your body and your lift and things have changed now too, but your physical health is everything. Cause you're on that floor, sometimes 10 hours a day. And you're bending, you're twisting, you're in positions, you're doing dental work, you're doing intravenous catheters, you're loading big 90-pound dogs for surgery. I'm a little thing. I'm not that big. But your body has to be in check because I've seen a lot of girls with back injuries, shoulder injuries. And what got me through the field physically, because a lot of people, they're like, I can't get up. They're all sore. I started training for figure competitions when I was 37. I tell you what, that turned my life around. It turned everything around because it kept me in the field longer. Having that physical strength and determination, it all transferred into me, and it went out to my patients. It enabled me to give the best care because I was at my best. Now, mentally, that average technician can burn out every 5 years, and it's like nursing. I've been there probably 3 times in my career for 25 years. I'm going to tell you that straight up. It's how it is.
Yeah.
You can lose your drive. You could lose it. You can get compassion fatigue. You're just seeing the same stuff, but it can get overwhelming when you have 5 or 6 euthanasias in a day in a row from the sick ones that were in the hospital that can't get treated anymore, from, emergencies, bad emergencies that you see, hit by cars, things like that. Technicians, multitaskers. Our brain's every which way. You have 8 patients on the board. You're working with the vet. We have to advocate for that pet because these guys can't be everywhere. That's where we come in. Oh, dog in cage 1, he looks painful. He sounds painful. I'm going to consult the vet. It's a lot of mental stuff. You're calculating fluid rates. It's just everything. So mentally, that's why technicians going to burn out. And I've had to what did I have to do to get through those? Training helped me. Physical training helped me. And because I let out the steam after I got out.
Yeah.
After a long day, it's time for it to hit the punching bag. People are like, "You're going to work out now?" But yep. But they think I'm crazy, some of them, but that's how I went. I had a lot of energy. I still do. But last thing about, so I had to reinvent myself every 6 years. We have to look for different things to make us happy in our field. It's not, oh, Jesus, another spag. I clip another spag. Nah, it's not that. Okay, I had to make, that hospital was my home. It becomes your home. And you do what you can to make the productive workflow good, or you're going to have a long day, or you're going to be bored. You got to learn new stuff every day about a medical case. Read journals. That's what I say. I still read. I have to hold credits every 2 years. I have to get 16 credits, but I'm still reading in between. That's how we get good at our job. We don't come out of technician school, or tech doesn't come out of school, or assistant doesn't come out of school. Well, I know all that. Well, no, I remember coming out of tech school 1992, and I knew stuff, but I didn't know as much as, man, I know now. It's different. You gain that bookwork with what you see in practice. And it's all dependent on how much you want to put forward. If you're not going to put your foot forward to learn more and to grow more, you're going to remain stagnant. And I can guarantee it, and you'll get burned out. I'm just saying how it is. And I, this, I was at the end of my thing. I was like, what am I going to do? What am I going to do? I have all this experience. I have to make it worth my while to help other dogs and cats where I can, when I can. It's not everybody, and that's my advice.
Nice.
Physical and mental, and talk to people if you need any help mentally.
You're right.
Talk to your vets. Talk to your managers. Talk to each other. Be there for each other in a veterinary working environment. You see a lot, you do a lot, you're pulled different directions, but we're irreplaceable. You're a veterinary technician, and I tell you what, clients, get to know your veterinary technicians, because they're very, very helpful. Because it's like we don't have PAs, like you have PAs for doctors, but there will be one day, and I'll probably be retired by then, because I always say stuff like that, because that's how it goes. There's going to be like a PA vet, I don't know what they're going to call it, tech or something. I don't know, PA, something where you're almost the next thing, because we're pretty close to the doctor. We don't know all the stuff, but we're trained and learning and growing. So if that makes sense.
Well, that's great advice. Number one, you're right. You do need the physicality, because one day you're dealing with, just a nice, 10-pound Chihuahua or something like that.
Yeah.
The next patient's a 100-pound,
Oh yeah, and guess what? It'll be at least when you expect it, because it'll be in the parking lot at 7:00 in the morning. Let me tell you what, you better be warmed up, because you got to do a deep squat to get that dog up off the ground and into the treatment room, off the ground on a stretcher. So
exactly, because
that is
the dog, like a human, just got hit by a car, just got something tragic, something close to tragic almost happened, and boom, now it's your responsibility to get that.
Yeah. And a lot of the times the technicians start stuff before the doctor even gets back into the room. And that's a known fact. I mean, look on TV. I mean, I'm not saying TV is vet med, but we're starting CPR. We're putting the tube in. We're intubating. We're getting stuff started. Usually the doctor's very close around, but we can start supplementing oxygen. We can start that, because that's what we do. We're a support team. So we all work as a team. It's a constant thing. Every patient is unique. Every treatment plan is unique. And that's how we progress with pet care.
Exactly. I also like the mental advice too. You're right. You stuff for your mental health, because you get, just think of what you go through on a day-to-day basis, just like doctors, just like that, Yeah. You see pets, everyone loves pets. Like when everyone thinks of pets, they think they love it, loving it. Imagine seeing that pet at its worst.
Yeah. And that's the hard part, especially when you see them decline and you're trying to get them past the point, but it's not going, or financial things happen. They can't go anymore. Hey, there's a lot of different things in vet med that I'm not even touching upon with mental health. And it's, and tell you what, that's another thing that wasn't, the resources they have now was not there in the 90s and 80s. It wasn't. And the same with research too. You had to research the field. I got the guidance counselors, like, go to the library and get a book. And you know what I found on 1984 or something like that? Vet assistant. I'm like, what's that? I mean, then my mom, and we just kept reading more stuff. And she found tech school, and there wasn't one around here. I had to go to Philly. Yay, that was awesome. I went to a college named Harcum College in Philadelphia, in Bryn Mawr. And my intern was at the University of Pennsylvania down at the medical center in Philadelphia. It was awesome. I was worth my while, and she aided me. But get someone to help you if you're willing to want to be a tech. Check your programs out. Talk to people. People can consult me on if what they want to do. It's a lot more resources than I had. That's why I like doing this and talking about it.
It truly sounds like your passion. It truly sounds like something you love. Waking up every morning going, I get to go to work rather than time to go to work. You know?
Well, I miss walking in those doors, but you know what? I like walking in other people's doors because then they're, it's a different feeling.
Exactly. Exactly. Well, buddy, thank you so much.
Oh yeah, thanks.
Here on Buddycast. I learned a lot today. It was a pleasure. It was a really great episode. So thank you.
Yeah, thank you.
And before we close out this episode, I have one favor to ask you. Whatever you do today, tomorrow, next week, next month, or even next year, please go be someone's buddy.
I will. I always am. And I tell you what, if I didn't have my buddies, I don't know what I would do without them.
Exactly.
Makes a big difference.
Yes. For all my buddies out there, this is my buddy Patty. Please, if you're in the Erie area, you need a vet tech, please reach out to her. Promise you, it'll be well worth it.
Yep.
I'm your host, Nick Sorensen. Thank you for joining us on another episode of everybody's favorite show, Buddycast.
Bye.
Well, the days are going fast, buddy, we've got to make them last, buddy, before they've all gone past, buddy, tune in to Buddycast. But don't be nutty, go make it, buddy, here on Buddycast.